Welcome back. Let's wrap up therapeutic communications. As an EMS provider, you can use special communication techniques to encourage patients to give you more information and to show them that you care. These are often called therapeutic communication techniques. Here are some of the key strategies: reflection, repeat back or paraphrase what the patient says to show you're listening and to encourage them to share more. You are reflecting their statement back to them. For example, if a patient says, "I just feel so weak," you might respond, "You're feeling very weak," in a sympathetic tone. This confirms that you heard them correctly and invites them to continue. The patient might then elaborate, "Yes, I started feeling weak this morning after I skipped breakfast." Reflection validates the patient's feelings or statements and often leads to more detail. Empathy. Express understanding and compassion for what the patient is feeling. Showing empathy helps the patient feel that you truly care about their situation. You might say something like, "I can imagine this pain is really hard to deal with. I'm sorry you're going through this, but we're going to take good care of you." With your tone of voice and words, you convey that you understand their fear, pain, or worry. Even a simple phrase like, "I know this is scary, but you're not alone. I'm right here with you," said gently, can significantly comfort a patient. Empathy is about connecting with the patient's emotions. It shows you acknowledge their feelings, like confrontation. In therapeutic communication, confrontation doesn't mean arguing or being aggressive. It means gently bringing up something you notice that the patient might be minimizing, denying, or not aware of. It's used to clear up discrepancies in their story or behavior in a caring manner. For instance, if a patient insists, "I'm fine, I don't need to go to the hospital," but you observe them grimacing and holding their side in pain, you might say, "I understand you don't think it's serious, but I can see you're in pain and that worries me. I really think we should get you checked out." This is a form of caring confrontation. You're pointing out the pain that contradicts their words to encourage them to accept help. The key is to be gentle and concerned, not accusatory. The goal is to help the patient acknowledge what's really going on so you can help them, not to provoke a defensive reaction. Interpretation. This is where you listen to all that the patient is telling you and then offer your understanding or an explanation of what you think they mean or what you think is going on, essentially reading between the lines. You are synthesizing information. For example, a patient might describe feeling dizzy and also mention they haven't eaten since yesterday. You could respond, "It sounds like you got dizzy after not eating all day, which makes me think your blood sugar might be low." Does that sound right to you? Here, you're interpreting their symptoms and checking if that interpretation fits. The patient might confirm, "Yes, I think that's it." Or they might say, maybe, but I also have a heart condition," which gives you further direction. Interpretation helps to clarify the situation and shows the patient you're actively trying to understand the whole picture. Facilitation. Use words or gestures to encourage the patient to continue talking. Simple actions like nodding your head or verbal cues like, "Go on, I see," or "Can you tell me more about that?" prompt the patient to keep sharing. Facilitation is basically you showing interest and giving permission for the patient to elaborate. If a patient starts explaining how they felt before calling 911 and then pauses, you might gently say, "And then what happened?" This encourages them to continue their story. Even your body language, like an attentive expression or leaning in slightly, can facilitate more communication by making the patient feel you care about what they're saying and are patiently awaiting more. Silence. It might sound counterintuitive, but silence can be a very effective communication tool. Purposeful pauses give the patient time to process and continue at their own pace. After asking an important question, if the patient doesn't answer right away, resist the urge to immediately fill the silence. Instead, stay quiet for a bit, while keeping a compassionate, attentive demeanor. This silence creates space for the patient to think or overcome emotions. For instance, if you ask, "How are you feeling about all of this?" and the patient looks away or seems to be gathering thoughts, just wait calmly. They may need a moment to formulate an answer or to stop themselves from crying. By allowing silence, you show that you're not rushing them and that you have time to listen. Often, the patient will break the silence with more information or questions of their own. Of course, you wouldn't want long silences if time is critical for treatment, but in conversation, a few seconds can be powerful. Clarification. Ask follow up questions when something the patient says is unclear or ambiguous. Patients might use vague terms or assume you know what they mean. Politely asking them to clarify shows that you care about understanding them correctly and that you're paying attention. If a patient says, "I'm feeling kind of funny," you might ask, "When you say funny, do you mean you're feeling dizzy or nauseated or something else?" Similarly, if a patient uses a term you're not familiar with, maybe a slang or a word in another language, don't guess. Ask them what it means. Clarification can also mean asking the patient to repeat something if you didn't catch it the first time. For example, "I'm sorry, I want to make sure I got that. How long did you say the pain has been there? It's better to ask again than to misunderstand a crucial detail. Patients generally appreciate when you clarify because it means you're truly trying to get it right. Redirection. Gently guide the conversation back to the relevant topic if the patient goes off on a tangent. It's natural for some people to stray, especially if they're anxious or if a certain detail triggers a long story. As the interviewer, you have to keep the conversation focused enough to get necessary information. For example, you're asking about today's chest pain, and the patient starts talking in depth about a surgery they had 10 years ago. While that history can be relevant, you might need details about now. You could respond, "That background is helpful. I'll make note of your surgery. Right now, can we focus on the chest pain you're having today? What did you feel when it first started?" In doing so, you acknowledge that what they said is important, so they feel heard, but you steer them back to the immediate issue. Redirection is done respectfully. You never want to make the patient feel cut off abruptly. It's a skill to balance empathy with efficiency, simplification, and summarization. Medical people often use jargon or complex terms by habit, but many patients won't understand those. Simplification means using plain language to explain medical situations or instructions. For instance, instead of telling a patient, "We think you might be having a myocardial infarction," you'd say, "We think you might be having a heart attack," which is easier to grasp. Or when explaining a procedure, avoid technical language like intubate. Say, "Help you breathe with a tube," if you needed to explain that. Summarization means periodically repeating back a summary of what the patient has told you, or summarizing the plan, to ensure everyone is on the same page. For example, "Let me make sure I have everything right. You have no major medical problems. You started feeling a sharp pain in your chest around 8 o'clock. You took 2 Tylenol, but the pain stayed at a 7 out of 10. And that's when your wife called 911, correct?" Summarizing like this serves two purposes. It shows the patient you heard all that they said, and it gives them a chance to correct anything you might have misunderstood. It's also a great way to transition in the conversation. After summarizing, you might move on to the next set of questions or to your treatment plan. All of these techniques can make your interaction with the patient more productive and compassionate. They encourage the patient to talk openly, and they show the patient that you're truly hearing and understanding them. Over time, as you practice, these strategies will start to feel natural. You'll get a sense of when to nod and stay quiet, when to paraphrase, when to express empathy, and so on. The result is better communication, which means better information for you and better care for the patient. Just as there are good techniques to use, there are also some common pitfalls to avoid when interviewing patients. Knowing these common errors can help you communicate more effectively by not falling into these traps. Never give false reassurance or make promises you can't keep. It's instinctive to want to comfort a patient, especially if they're scared or anxious. But be careful about saying things like, "You'll be fine, I promise," or "Don't worry, everything will be okay." We usually cannot guarantee the outcome, and if things turn out differently, the patient or their family might feel misled or betrayed. Moreover, saying "you'll be fine" might make a patient feel that you're not taking their concerns seriously. For example, if they feel very not fine. A better approach is to reassure without giving false guarantees. Instead of saying "you'll be fine," you can say, "We're doing everything we can for you, and we'll stay right here with you," or "You're in good hands, we'll take care of you." This way, you're being honest and supportive without promising something out of your control. It maintains trust. You're offering comfort, but still being truthful. Diagnosing or giving advice beyond your role. In the heat of the moment, you might recognize signs of a specific condition, but be cautious about labeling it or giving medical advice. For example, even if you strongly suspect a stroke, you shouldn't definitively say, "You're having a stroke," because you could be wrong or premature. And that diagnosis will ultimately come from hospital tests. Instead, you might say, "Your symptoms make me concerned about a stroke. We're going to get you to the hospital quickly so they can treat it if it is one." That informs the patient of the seriousness without overstepping. Similarly, avoid giving medical advice like, "I think you should take an extra blood pressure pill when this happens," or "When we get to the hospital, you should ask for XYZ." Those decisions are for doctors. Your job is to provide immediate care and transport. So stick to what you know and what you're doing. For instance, "We're going to start an IV and give you some medication to help with the pain while we get you to the ER. The doctors there will do some tests to find out exactly what's going on." This keeps the patient informed about your care without straying into diagnosis or treatment plans that are beyond your scope. It's both ethical and it protects you legally. Avoid asking leading questions. A leading question is one that suggests its own answer or influences the patient's response. This can lead to skewed or unreliable information. For example, asking, "It's not a bad pain, is it?" implies that you expect the pain to be mild. A patient might automatically agree and say, "No, not too bad," even if actually the pain is quite severe, because they feel that's the answer you're looking for. Another example? "You've taken your medications today, right?" The patient might say, "Yeah," even if they forgot their dose, because the phrasing suggests that not taking them would be wrong. To avoid this, ask neutral, open questions instead. So rather than, "It's not a bad pain, is it?" you'd ask, "How would you describe your pain?" And instead of, "You've taken your medications, right?" ask, "Have you taken your medications today? If so, what time?" This way, you're not putting any answer in their mouth. Leading questions usually come from a good intention, you think you know what's going on, or you want to speed things up, but they can cause you to miss the true story. Always let the patient describe things in their own words as much as possible. Don't interrupt or talk over the patient. Good communication is as much about listening as it is about talking. If you constantly interrupt the patient or talk over them, two problems arise. You might miss important information, and the patient may feel frustrated or decide it's not worth trying to tell you things. We know emergency scenes can be time pressured, and sometimes you do need to cut to the chase, but even then, you can do it courteously. If a patient is giving a very long answer and you need a specific piece of info urgently, you might interject gently, "Excuse me for interrupting. I want to make sure I understand, when did the pain start?" However, whenever possible, let the patient finish their thought before you speak. Use active listening signals, nod, say huh, or I see, to show you're engaged while they talk, rather than interjecting your own stories or finishing their sentences. Also, be mindful not to dominate the conversation with medical jargon or unnecessary commentary. Remember, the interaction is about the patient's situation, not about the provider. If you spend too much time talking, you might inadvertently steer the conversation away from the information you need from the patient. After asking a question, truly listen to the answer. If the patient goes off track, use redirection, as we discussed, rather than just cutting them off abruptly. Avoiding these errors will make your communication much more effective. Patients will sense that you're honest, attentive, and focused on them, which in turn builds trust. When patients trust you, they will be more forthcoming with information and more cooperative with your care. In an emergency, that can make a significant difference in both the patient's experience and the outcome. Communication isn't only about what you say, it's also about how you say it and how you present yourself. Nonverbal communication can speak volumes. Your body language, tone of voice, facial expressions, and even how you carry yourself can greatly affect a patient's comfort level and trust in you. Let's break down some important nonverbal elements. First impressions happen quickly. When you arrive on scene, how you look and behave in the first moment sets the tone. A neat professional appearance, like a clean uniform, proper grooming, and your EMS identification visible, helps establish confidence and trust. Imagine you're the patient. If the EMT, AEMT, or paramedic walking in looks sloppy, disorganized, or is acting hurried and flustered, you might feel less secure about the care you're going to receive. So take a moment to compose yourself before you face the patient. Stand and move with purpose, but without panic. Even if the situation is chaotic, try to appear calm and in control. Approach the patient with a calm expression. A friendly greeting can make a big difference. Body language and posture. Your posture and movements should convey openness and empathy, not aggression or impatience. Try to keep an open, relaxed posture. That means avoid crossing your arms, which can look defensive or impatient, and don't clench your fists or put your hands on your hips in a domineering way. When talking to a patient, if they are seated or lying down, get down to their eye level if possible. Kneel or bend down rather than standing over them, which can feel intimidating. Maintain appropriate eye contact, enough to show you're paying attention, but not staring so much that it feels like you're drilling them. You can periodically glance at what you're doing, like preparing equipment, but always return focus to the patient's face to show engagement. Your facial expressions should match the situation. Look concerned when they're describing pain. Smile gently if they're making a bit of small talk or if you're reassuring them. Be careful not to show disgust, shock, or frustration in your face, even if the situation is challenging. Patients pick up on that. Also, be mindful of personal space. Generally, being about an arm's length away is a good starting point when first interacting, unless you need to be closer for treatment. If a patient seems very anxious or upset, giving them a bit more space, while still ensuring you can treat them, might help them feel less threatened. Conversely, if a patient seems very scared and reaches out, you can lean in a bit to show you're there for them. Always read the patient's cues and adjust. Overall, think of your body language as another form of reassurance. You want to appear attentive, composed, and caring. How you speak to the patient can be just as important as what you say. Use a tone that is calm, clear, and compassionate. Even if you need to speak loudly because of background noise or because the patient is hard of hearing, try to keep your voice steady and kind, not harsh. Avoid shouting in a panicked way. Loud is okay if needed, but it should still sound controlled. Being patient means not only giving the patient time to answer, but also not rushing your own words. Speak at a pace that is easy to follow. If the patient is having trouble understanding you, try simplifying your phrasing rather than just repeating the same words louder. Also, watch out for the tendency to become short or curt when stressed. For example, if a patient is not following instructions, instead of snapping at them, you might take a breath and say, I know you're in pain, but try to stay as still as you can for me, okay? I don't want you to hurt yourself more. Additionally, be patient when listening to the patient. Some patients, especially the elderly or those have an emotional response to what is going on, may take longer to express themselves, resist the urge to finish their sentences, or cut them off. If they drift off topic, you can gently redirect, but do it politely. Your voice should convey that you have time for them. This patience in your voice helps keep the patient calm and reassured. They feel respected and heard. Touch and personal space. A simple, appropriate touch can be very comforting to someone in crisis. Humans often communicate care through touch, and this can be true in EMS as well, when done correctly. If it feels appropriate and the patient seems receptive, you might gently touch the patient's shoulder or arm, or hold their hand for a moment, especially if they are very upset, crying, or extremely frightened. If an elderly woman is sobbing after a fall, a light touch on her hand and a steady, I'm here with you, can be deeply reassuring. Or if a child is afraid, sometimes a gentle pat on the back and maybe giving them a stuffed animal if you carry one for pediatric calls can help. However, it's crucial to be sensitive and respectful with touch. Everyone has different comfort levels and cultural norms about being touched by a stranger. Pay attention to the patient's cues. If they pull away, flinch, or seem to tense up when you touch them, then back off. An apology like, I'm sorry, I didn't mean to make you uncomfortable, can smooth things over if a touch wasn't welcome. Also consider the context. For a patient who is angry or agitated, it's usually best not to touch them without warning. They could perceive it as a threat or restraint. In those cases, focus on calming words and give them space until they, hopefully, become calmer and more accepting of assistance. On the other hand, for a patient who is dazed and withdrawn, a gentle touch might help ground them and let them know you're present and caring. Always ask yourself, could a touch help here or not? And err on the side of caution if you're unsure. When you do use therapeutic touch, pair it with your verbal communication. I'm going to put my hand on your shoulder, okay? I'm right here with you. This way, the patient isn't surprised, and the touch aligns with your reassuring message. To wrap up, remember that your verbal and nonverbal communication together create the overall message you send to patients. You want your words and actions to match. If you tell a patient, I'm here to help you, but your face looks worried and you're fidgeting or rushing, the patient might not feel very safe or confident in you. But if you say those same words in a steady, caring voice while maintaining eye contact and a calm presence, the patient is far more likely to believe you and feel comforted. Through therapeutic communication, using all the skills we've discussed, from empathy and active listening to respectful body language and tone, you help patients feel at ease in a situation that is inherently stressful. This builds their trust in you and the EMS system as a whole, and it leads to better cooperation, like following instructions or providing information, which ultimately helps you provide better care. Effective communication is truly one of the most valuable tools you have as an EMS professional. Like any skill, it gets better with practice, so I encourage you to be mindful of how you communicate on each call. Thank you for your attention, and I hope these concepts will help you in your future patient interactions. Good luck and stay safe out there.